Hi, I'm Caitlin Toth. I'm a Miller Center Fellow working in the 2020-2021 cohort, and I'm here with Manoj. Manoj, do you want to give an introduction?
Hi everyone, I'm Manoj, co-founder of Nemo.Care Wellness. We were a part of the GSBI cohort in 2019 and attended the residence.
Yeah, and today we're going over one of two deliverables that were curated for the fellowship. These two documents were synthesized based on the best practices that I found in some of the health technology assessments that are put out by India, with the goal of being able to inform users about the nuances or justifications for certain studies and how to make evidence-based claims. So we're going to start with a brief overview of the evidence-based readiness flowchart. And the goal of this is, again, to generate evidence-based claims, specifically about a health technology or a health intervention, with the goal of talking to stakeholders and being able to back up the claims you talk about. And the two pillars that this document leans on is that of clinical efficacy and also of cost efficiency. And later we'll go a little bit into more detail about why those two were chosen and what their significance are for the Indian healthcare sector. But that's the goal of this document, is to give a visual depiction of some of the questions that are relevant to ask. And annotated on this document are references that link back to the comprehensive manual that should be able to explain things in more detail. So now to the comprehensive manual. It begins with a summary of research activities, sort of how I arrived at how to create this work, and then goes into detail about some of the more nuanced and detailed background information with reference to the literature that is cited. And so, again, the whole goal of this is, can I prove these things to my audience, these claims I'm making? And a little bit about who, there's a suggestion in the flowchart about who you might be talking about. And Manoj, yeah, who are some of the various people that operate in the healthcare system?
Yeah, so this is one of the biggest learnings we had as we started our journey is though our solutions are meant towards ensuring better outcomes for the patients, healthcare is a multi-stakeholder system. We have the doctors, the care providers, the nurses, admin staff, biomedical staff, and the policy level members. And what we realized, and especially in the work that's come out as well, is that each stakeholder looks out for different values across the value chain. And that's something that these innovations have to cater to ensure that they are adopted.
Yeah, that's perfect. And yeah, there's a whole breadth of people that are involved in the healthcare process, from top to bottom. There's more than I could list. That would take a whole document, but yeah, they definitely have different interests and different things, and are taking stock of value in all of the products they use. I'm sure there's very, very few things that are in, a clinic or a hospital or in a doctor's private practice that are there without any sort of thought. People in the healthcare system tend to be incredibly intentional with the products they integrate, and the different ways they do that. So yeah, thank you. And the document will break down each of the different sides of the flowchart. So it starts with clinical efficiency, and has relevant annotations. And obviously for any healthcare product, it's relevant to consider any harm it does, if it does what it's supposed to do, if it's specific, if it's sensitive, if it prevents the adverse health outcomes it's trying to, things like that. These are obvious. But this side is balanced with cost efficiency. which involves all of the different things to consider about how one might introduce a product, if it's possible to within the systems, things like that.
Yeah, so the first important thing was on getting the clinical evidence right, because that's the bare requirement that is needed for adoption, saying you have substantial equivalence to the gold standard practices, though you're innovative. But an equally important factor is the cost effectiveness, especially in price sensitive markets. Uh, Healthcare is mostly out of pocket, and affordability is a key factor for any intervention becoming mainstream. So there is a lot of emphasis that has to go into this, saying, is it at the right spot for a mass commercialization or being adopted across segments in emerging markets? Because this is where the larger companies, or mostly the bigger players, miss out or don't target these emerging markets, is they don't fall into even 5% of their revenue shares. So that's what innovative products and especially the emerging startups are trying to target. So keeping emphasis on cost effectiveness is a very key factor.
Yeah, I totally agree. And something Manoj said earlier is that you shouldn't be sacrificing the clinical efficacy of your product to make it cost efficient. Like at no point should you be sacrificing the value of a product's ability to perform its healthcare function. And I thought that was super, super relevant. And at the end of the document, for those that are interested, it talks about the references that are involved, the rationale and HTA framework. And then for those who aren't familiar with the health technology assessment process, specifically in India, there's a breakdown sort of what that process looks like, why it's relevant, and the chain of events that happen within that process that's rather complex, and some relevant further readings for those who are interested again. And so thank you for your time, Manoj. Thank you for anyone who's listening. I hope that it's an interesting read, if nothing else. And these are the two documents of relevance.
Thanks, Caitlin, for taking time to work on this project. And we're hoping to use this into our mainstream of work to ensure that NemoCare can scale, and many more public health interventions can use this to ensure that we actually achieve this impact at scale that we started out our journeys with. Thanks, Caitlin, and our gratitude towards the Miller Center and all the faculty members who are involved in the event.
Yeah, perfect. Thank you. I also hope everyone flourishes, everyone thrives, including the patients, the doctors, and all of the people who are behind the scenes working on these things. It's incredibly important. So thank you for your time.